In special education, the question is not only whether an intervention is well designed, but whether it is implemented as intended and produces meaningful outcomes for the learner. Week 13 focuses on evaluating intervention effectiveness through 4 interconnected lenses: fidelity of implementation, social validity, progress monitoring and data interpretation, and overall intervention evaluation. In a rigorous educational framework, these elements move us from intuition to evidence and from isolated practices to accountable decision-making. Fidelity of implementation refers to the degree to which an intervention is delivered as intended. If the instructional or behavioral procedures are altered substantially, then changes in student outcomes cannot be confidently attributed to the intervention itself. High fidelity strengthens internal validity and allows educators to determine whether a lack of progress reflects an ineffective intervention or inconsistent delivery. Visual representations such as checklists, flowcharts, and side-by-side comparisons can clarify this relationship by showing the intended procedure versus the observed practice. Social validity addresses a different but equally important question. Is the intervention meaningful, acceptable, and appropriate to students, families, and educators? An intervention may be statistically effective yet still be impractical, culturally misaligned, or burdensome to implement. In this sense, social validity connects empirical evidence with human experience. It asks whether goals are important, procedures are tolerable, and outcomes are valued. This concept is central to ethical special education because it ensures that effectiveness is not defined narrowly by numbers alone. Progress monitoring provides the ongoing data needed to determine whether a student is responding to intervention. Frequent measurement, graphing, and trend analysis allow educators to detect growth, stagnation, or regression over time. When interpreted carefully, these data support instructional adjustments before failure becomes entrenched. Animations that show data points accumulating across weeks can help illustrate how patterns emerge and how decision rules guide changes in intensity, duration, or instructional strategy. Intervention evaluation integrates these components into a coherent decision-making process. Educators examine whether the intervention was implemented with fidelity, whether stakeholders view it as socially valid, and whether student data demonstrate meaningful improvement. This evaluation is not a one-time event. It is cyclical, reflective, and responsive. In the context of special education, such evaluation supports individualized programming, strengthens professional accountability, and advances equitable outcomes for students with diverse needs. Ultimately, effective intervention is demonstrated when practice is consistent, acceptable, measurable, and responsive to learner growth.